My name is Dr. Joy. I'm a pediatric surgeon. I know that Dr. Anjali and Dr. Jose has taught you a lot of dentistry. But before I talk about my subject, I think you are all tired. Can we just rise up for a minute, stretch up, down, and then we'll start listening to my way of dealing with things. Can we just stand up? If you want to just jump, you can jump. Stretch your hands and legs, and be ready. Ready? Okay, you may be seated. Thank you so much. So I'm a pediatric surgeon, pediatric dentist, in the sense I treat children. I treat children from birth till they are about 14 or 15 years. And the most important problem for which children are brought to me is maybe at 6 years of age, when they come and tell me that they have malaligned teeth, irregular teeth. So the topic that I will be discussing today is malaligned teeth in children, the problems and its consequences, as well as how we can manage it. Now, 1,000 years before, it is said there was no malaligned teeth. If you just look at the old skulls which are excavated and look at the dentition, you see a perfect set of teeth. I have not seen a 1,000-year-old skull, but I tell you that I have seen the dentition of my grandparents and my parents. I'm from the central part of Kerala, and what I have seen there is my grandfather and my father had perfect set of teeth. But when it came to my side, I had my one tooth extracted to align the other teeth. Now, 1,000 years before, it is said that there was no malocclusion, no malaligned teeth. In Kerala, what I have seen is, in the last 75 years, we have a lot of children with malaligned teeth. And I was traveling throughout India to see whether this is the scenario throughout. But I have seen that in the northern part of India, the incidence of malaligned teeth is slightly lesser. One thing is possibly because of the diet that you have. You chew a lot. But the alarming situation is in Kerala, where we just changed our diet, and the change in the diet has really resulted in a lot of dental problems and lack of jaw development in this part. Now, in the last 75 years, and the recent data says that if you take around 100 children, around 83 to 87% of these children have irregularly aligned teeth or malaligned teeth. What has happened in this last 75 years which make it so big a problem? So we just examined into it. Everything is the same. But the only thing that we have observed is in two things. The type of food that we eat. I remember that when I was a small child, at 4 o'clock when we come back from the school, the first thing that we used to do is just to go to the backyard, climb on a tree, and then get some fruits and eat. It may be hard, it may be soft, but we used to relish it. I usually call these as backyard pharmacies. Backyard pharmacies. Now I call this backyard sciences because it's an exercise for us. You get the fruit and eat, and then you get all the nutrients that are required from that place. Now think about a child of living in Cochin now today, in a flat which doesn't have all this. Now the chewing ability, or children don't chew at all. Now scientific studies say that if you can chew your food for 15 minutes a day, you will not have irregular teeth. You chew your food for 15 minutes a day, you will not have irregular teeth because the jaw will develop properly, and then every tooth will have a place to sit there, and then you won't have any problem. Now the two things that are of concern to me is the lack of chewing ability which is seen in children, which may be of various reasons. And one more thing which I have found is the way children breathe. Do you know that if I tell you that crooked teeth has nothing to do with teeth, will you agree with me? If I say that irregular teeth or crooked teeth has nothing to do with teeth, will you agree? I can tell you that if you are breathing through your nose, that is perfect. But the moment you breathe through your mouth, you are inviting a lot of troubles. Now, what has happened in pollution is because of too much of pollutants in the air, our children get diseases, they get upper respiratory tract infections, adenoids, tonsillitis, cough, cold, which makes this nose block. So what will they do? They naturally open their mouth and start breathing through the mouth. But after the cough and cold gets over, they are not trained to breathe back through the nose. Now what will happen as a result of breathing through the mouth? If you just examine and look at the children that are sitting next to you, you will see that the present generation of children will have their lips apart or mouth apart. All of the people who are sitting here, you are sitting with your lip closed or lip seal. We call the lip seal. But in present day generation, we won't see children with that proper lip seal. So what happens is the air starts moving through the mouth into the lungs. To facilitate that, the tongue has to slightly dip down. We call this the tongue drop. So when the tongue drops down, it is exerting little pressure on the lower jaw, causing the lower jaw to grow downwards. Now, if you examine adults, you can see that most of the old people will have very strong face, big face. But if you examine the present day children, all of them have long face. It's like a rubber pulled down, the elastic which is pulled down. The reason is because the tongue drops, it exerts pressure on the lower jaw, causing the lower jaw to go down, grow down. And the tongue, which usually sits on the upper jaw, moves down. If you can imagine this as your palate or the top of your mouth, the tongue has to support it and the teeth has to support it from either side. When the tongue drops from the roof starts coming down. So that's the reason why you have a lengthy face. Now we call this phenomenon the facial meltdown. It is like you are taking a wax pattern and taking it close to a fire, and then you'll see that this face is melted down. This is a global phenomenon which we are seeing now. We call it as the facial meltdown. It's because the way the children breathe have changed, and they are now breathing through the mouth, causing the tongue to drop down, causing the maxilla or the upper jaw to grow downwards, as well as causing the length to have a long. And apart from this, when the maxilla or the jaw grows down, it becomes compressed from side. So the tongue will not have proper place to sit there. So the tongue has to go back. When the tongue goes back, there is no airway, or the airway is blocked. The air that goes from the nose to the lungs is blocked. So such children will have snoring, and they will have disturbed sleep. Because the moment the oxygen supply to the brain is disturbed, you will have lack of sleep. So such children usually will have an under-eye shadow, a shadow just underneath the eye. And eventually when they wake up, they will not be refreshed. They will have sleep problems. Eventually it can result in hallucinations, or you might have seen the cinema, the movie where Amir Khan acted Tare Zameen Par. The typical character is displayed. The boy is displayed like a boy who keeps his mouth open and breathe through the mouth. And the entire character of that boy, as well as what he is going through, is not because of anything, that is because of his disordered breathing. So, as a pediatric dentist, I am very much aware about the fact that it is utmost important that we should examine at the children and the way they breathe. If the way they breathe is correct, most of the problems in the jaw can be prevented. Being naturopaths, being a good crowd who can understand and listen to what I am trying to convey, I think it is your job that whenever you see a child with lack of lip seal, there are two types of lip seal. Like if you ask the child to close the mouth, they will close. But if you ask the child, just talk to the child casually and see that after the end of their speaking, if they keep their lips apart, that means the child is a mouth breather. Observe children when they are sleeping. If they are sleeping with the mouth open, It's a mouth breather. So if he's a mouth breather, then he will have all the following characteristics. Like he will have a shadow underneath the eye, a depressed nasal bridge. We call the tipping of nose. You have the lower lip bulged out, and you have this fold much more going inside. And whenever they try to close the lips, you see a ball-like thing here we call the golf ball. And most of these children have a shoulder coming to the front as well as neck to the front. So if you can just imagine about your head as a 5-kilogram ball, and imagine that is being positioned by your neck. If your head is tilted forward, what will happen to your neck? Your neck muscles have to strain a lot to keep it in that place. So when the neck muscles strain, the shoulder muscles and the back muscles compensate. Now, if this goes on continuously for years together, do you know most of the back problems, the neck problems, and the spine problems that people complain can be connected to the way in which children are breathing or people are breathing. So what we have seen is we have observed so many people, so many children, and we tried to work on their breathing. And we have seen that when we work on their breathing, they change. And they change to have beautiful, better faces in the best natural way. So I'm not telling that crooked teeth has to be treated with any type of treatment, but this can be prevented if you can identify children with wrong habits like mouth breathing. And children should be encouraged to chew their food at least for 15 minutes. If you can do these two things, chew the food for 15 minutes of a day and make them breathe through your nose, then most of the problems that are associated with the teeth can be completely eliminated. So this is the message that I want to take, pass it on to you. So wherever you go, wherever you see children, wherever you see that children are breathing through the mouth, and all sort of complaints that children might tell you, because in your practice probably children will come and say that he has bad dreams, he's not sleeping properly, he's not eating properly. All this could be, you just look at the way they are breathing. And if you can just correct the breathing, that's the best way to get the child going in the proper direction. Thank you so much. If any of you would like to ask me some questions, because it's a new topic, I can, whatever I know, I can share with you.
One or two questions, if you have any question.
Either you have fully understood or you have not understood anything at all.
One question is.
Yeah.
Thank you for enlightening us on the danger of amalgams, mercury. What are the findings on the new materials that are being used now in its place?
That's a topic handled by Jose, but anyway, I think I can explain. Most of the materials that are used presently have to pass through lot of testing procedures in animals as well as in human beings, and they pass through lots of testing and testing and testing before it is finally approved for use in humans. Now, I can tell you that the way these tests are carried out in different parts of the world are different. The way these tests are carried out in US is totally different from the way these tests are carried out in India. Or we may not have all the testing parameters or testing machines to completely test its efficiency or its problem right now. Now, all the materials other than what you have in your teeth, natural, are artificial, and all of them have problems. But if you just leave the tooth like that without filling, and if you just restore it, we will always look at the balance. What are the implications if you just leave it like that? And what if we just get it filled? The risk and the benefit is outweighed, and if you see that the benefits outweigh the risk, we go for it. Now, the recent materials which we are using in the industry other than amalgam have been brought to dentistry from 1960 onwards. So if you look at the long-term study, from 1960 to 2018 is the maximum period that is available. But amalgam, it is there for centuries together. So at present, with this 60 years or less than 60 years of span, and every time the materials are being updated or improved upon, at present, I don't think, compared to leaving it like that or without restoring it, if you just do a restoration, it is good and safe for the patient. Yeah. Exactly, I'll tell you, the best thing is not to put anything. Preserve what you have. But for some reason, if you can't, and if it fails, then the only option is to restore it. And I have seen people who have just left it like that. I have seen that, I have read that in prehistoric times, by the age a person reaches 45 or 46, his teeth would be treated to the gum level. And such people never had any problems. Because now that type of wearing was because of the tremendous chewing forces they had to use. They used teeth not only for chewing, but even to tan the leather. So because of that, it's a slow process. So when things are going, and a disease is going slowly, the body gets time to get accommodated to it. But if the disease is proceeding at a faster pace, then we need to put an end to it. Because as you rightly said, any foreign material to the body is not good. But it all depends on how the disease is spreading. If the tooth are getting degenerated fast, then we need to take action. But if it is generating slowly, like it is because of tooth wear, of chewing, then the tooth wear happens slowly, so the body gets time to manage it, and you will not have a problem.